are presenting on a very, very relevant topic. How do I follow CABG patients? So, is it the start of the treatment or it is the end of the treatment?
That's a very remark. Actually, if you ask me, coronary artery bypass surgery is the beginning of the real treatment, from where the all the strategies of prevention start. See, CABGs, in spite of all the new developments, continue to be one of the most attractive treatment for coronary artery disease, particularly advanced coronary artery disease.
True.
Sometimes, unfortunately, patient or even the treating surgeons think that this is final treatment and patient may not need anything after that. But that's a certainly wrong impression if you understand the pathology of this disease. For all the reasons, the disease continues even after CABG, and many of them return back in few years' time, depending on risk factors and all. So it's very important to follow these patients to make sure that risk factors, particularly like diabetes, hypertension, smoking, cholesterol and all, they are not only well under control, they are actually very intensely under control. Like we recommend intense lowering of LDL by high dose statins after bypass surgeries. So it's very important to prevent the disease or the progression of the disease after such an event, which is a major event. Nobody likes to have surgeries again and again.
True. So after post CABG, so what are the key medications the patient should be put on? One is, you said, high dose of statins. So other than statins, what are the other class of agents to be given?
Yeah, for example, the antiplatelet drugs are mandatory.
True.
There are almost all the trials have shown that if you use antiplatelets in a proper fashion, then you save almost like 50% of recurrent events.
So which agent and duration of which
The
agent?
most standard agent so far in all the trials has been aspirin.
True.
The change of the concept is that aspirin earlier on, many years ago, surgeons used to start later, after few days, few weeks of bypass surgery. But then newer trials have shown that earlier you start, to the extent that the recent recommendations are start within few hours, within 6 hours, 12 hours, as soon as possible, so that the vascular events are protected. So aspirin is standard. Then those patients who present to us with acute syndromes, acute coronary syndrome like acute MI or unstable angina, those should be given dual antiplatelet, 2 antiplatelets, even after surgery, at least for a year.
Okay.
So that is the current recommendation.
True. What is the role of RAS inhibitors in these group of patients?
RAS inhibitors in general will prevent recurrence of coronary artery disease, even without bypass, with bypass, or after angioplasty, and any event occurs. The inhibitors, but AC inhibitors, AR blockers must be used. One should try to find the place of use of AC inhibitor in particular patient, unless there is a reason not to use, for different reasons. So ACE inhibitors prevent progression of coronary artery disease. Beta blockers, ACE inhibitors, antiplatelets, and statins. These are the main treatments which should be offered to.
So what is the usual life of these graft which we are putting in? So many patients now we are going to repeat CABG procedures.
Yeah, repeat CABG we are seeing more and more because patients are living longer and longer.
Yes, sir.
So you have to live, you have to be alive to have further disease.
Yeah.
So with the progression of medical treatment, because of good medical treatment after CABG, antiplatelets, beta blockers and all, people are living longer, definitely. So we are seeing more occlusions of the grafts. On average, about 10 to 15% grafts will occlude within 1 year.
Okay.
That is the statistics from the best centers in the world. And after 1 year, it's about 3 to 5% every year.
Okay.
So more than 50% patients will have grafts occlusion within 5 years.
Okay.
And the most critical time after a successful good bypass surgery of getting back the symptoms is between 5 to 10 years.
Okay.
If for some reason people don't get symptoms for 10 years, they are the people who are best protected and they probably will not get symptoms even longer. But most importantly, 5 to 10 years is the time when they will start getting trouble again. So we should be very cautious in following them, and particularly after 5 years, one should be more cautious in.
True. But what you correctly said, if we are following these patients with the right dose of statins RAS blockers, beta blockers, and dual antiplatelets. So probably we can prolong this duration of repeat
This is
procedure.
exactly what we want to emphasize, that after bypass, one has to be a little more aggressive than before bypass as far as prevention is concerned, so that the benefits of bypass last
And I think
longer.
this message we need to deliver to the physicians, because post event many of these doctors, many of these patients go back to their family physicians. And they should realize the importance of all these.
That's very, very important, that primary physician or primary cardiologists, they should know that post bypass all the preventive strategies, including risk factor reduction, healthy lifestyle, diet, and all that, and total complete cessation of smoking, all those things are very important to maintain the benefit of bypass surgery.
Thank you, sir. Thanks a lot for sharing your views, and thank you for joining.
The beginning of the real treatment, from where the all these strategies of preventions start. See, CABG is